Welcome back, those who have come back for a little more epic advanced training action. So just quick little look at a daily schedule. I'm still figuring this out, right? And then the flags you're usually used to, right? So the provider ready or nurse ready, right? I think a combination of this over on the far left, you'll have these colors. And then whatever color you choose, then and that message will be over here in the status. So this is the status color, and this is the status message. Then there's another kind of a color area here. Haven't learned what that's about yet. Is that kind of a communication that doesn't involve status communication, or on a multi-patient schedule to identify patients for a certain provider? So hopefully when I get my full training, I'll learn some of those things. But definitely want to make sure we have room numbers, and this seems to require a little bit more active involvement by the provider if we're going to have this waiting for physician get used. All right, so that's not even the point of our talk here. But otherwise, that schedule works exactly the same. When they've arrived, they're there. You can just double click on it, and it will take you to the chart. This visit has a lot of stuff in there that's great to get that visit taken care of, especially those visit diagnoses, right? If you watch my last video on the Q-do, labs do, kind of logic-based, what labs are due for the patient, well, get the diagnoses in here. Off of here's their problem list, and you'd have an opportunity to add it as a problem. So yeah, if you add a visit, and remember, this is the big difference between Epic and Allscripts. I could add 10 visit diagnoses, but those diagnoses won't automatically populate the problem list, right? In Allscripts, you had an active problems list, and whatever diagnosis you added as a visit diagnosis, that diagnosis would stay on the problem list until you resolved it. So a little bit different here. It's like you have two parallel lists of diagnoses. The problem list kind of take the opportunity to put things in there that are unresolved, being actively managed. Visit diagnoses that may have a durational component where they're going to quickly go away aren't really problems, so it's nice. It won't clutter up, but if you quickly add diabetes as a visit diagnosis and forget to add it as a problem list, well, then it won't be there the next time, and it won't work with the logic-based types of ordering things that are geared off of the problem list, not off of that visit diagnosis in some cases. So I'm going to point that out: visit diagnoses and problem list. But the point of this video is care gaps. So first thing, going back into, what tools have we covered so far? So this, by now, hopefully you've known, you can access the tools that I built here using that Q Tools smart link that activates that area to get to this. So I've covered the notes in 3 videos. I've covered the Q-do in the most recent other video. I'm wanting to get you to the point of covering these full smart sets, right? This is a smart group only dealing with labs, but the smart sets deal with notes, diagnoses, labs, health maintenance. So what I'm covering today is the health maintenance care gap area. So this is less of a custom area. This is part of the foundation that we've been building. I'm part of this team. You'll hear the team called Healthy Planet. Healthy Planet deals with the health maintenance care gap, which is kind of like our current CQS. It also deals with a lot of the quality reporting, both to the individual insurance companies, the HMOs, the HCC terminology, right, where those diagnoses that need to be assessed every year for the Medicare and commercial HMOs, Medicaid HMOs, because of the quality of care impact of certain high-risk diagnoses. So the Healthy Planet team is very much involved in all the tools to better manage those kinds of health maintenance quality activities. And so the one that I've been very involved with is care gaps. All right, so when it comes to care gaps, this is very similar to the CQS quality dashboard. This is, this is like the patient CQS patient dashboard, but it will also live in the storyboard and give you a quick view of what gaps are there. And once you're in the context of an encounter, I went off of the schedule, so I'm in the context of an encounter, then each care gap will have an order set, all right, a smart group order set next to it to help order that item. In addition, up at the very top, you see this one icon with two green checkbox. You see, if you hover to discover, open a smart set to address open care gaps. All right. The typical thing that gets done is this gets configured to just order everything. And as I looked at that, I didn't feel like it made practical sense from the standpoint of knowing that nurses many times help with a lot of the vaccines, and the doctors making choices at each visit as far as what gaps to address. So this mega smart group is not so mega because and it can be adjusted. This has gone over with the council, but it will pop up a list of orders for the mostly non-vaccine care gaps relevant, that most of the time it's the providers that are going to initiate the orders for those care gaps. All right, so we'll take a look at that by clicking on that icon. All right, so we now have what's called the dynamic smart set, a health maintenance dynamic smart set. And it's saying that, okay, based off of the logic in this chart, really the main one that the doctor can order here at this time is the hepatitis C screening. See, there's other care gaps, vaccine, so they're all vaccines, right? Because I think this is also relevant of if for some reason it's a new, older person and we don't have their vaccine records yet, right? If you put that smart set into play, the mega smart set, it's going to order a bunch of stuff that they really don't need. You just haven't gotten the records yet, or the Florida shots hasn't updated yet, right? So I think this will be more usable the way as configured of mostly non-vaccine care gaps. I can still come in and say, oh yeah, well, I do want them to get the flu shot today, and the nurse didn't do it yet. So I'm going to go ahead and put in an order for the flu shot. So I can come to my storyboard and I can activate that individual care gap smart group, right? So here it is, showing me what vaccine has been pre-chosen, right? Giving me the opportunity to get some clinical information in there saying that no quadrivalent vaccines recommended for the 24-25 season. And then if I needed to change it, I have the opportunity to change it. If I need to cancel it, I can come to my X over here and cancel that. All right. So, and then notice when I put this smart set for the hepatitis C, it now put a little clipboard there. Instead of a red overdue, I now have a clipboard showing that it's been ordered, right? Order, place this encounter. All right. So then the other thing I haven't talked about with this icon is, this other little plus icon here. This acts like a manual entry. Let's say they tell me, or I have the documentation in front of me that they received an HPV vaccine, right? So I can click that plus sign, and it gives me an option to document past, postpone, or discontinue. They say they're flat out, no, I'm not going to have this vaccine, and so just discontinue it. You won't have to see it. You can postpone it for a period of time. Is usually a better option. But let's say I want to document past immunization. I have the documentation in front of me that they had it done January 24th, 2024. And that they had a Gardasil at that time, Gardasil 9. All right, accept. So now HPV is here saying, oh, they're still overdue because they need multiple doses, right? But so maybe I want to read more about that. Well, I can click the name of it and then get some more information here of when the recommended next dose will be due, right? So they received it back in 2024. And so January 24th, they could have gotten the second dose. February 21st, right, with the grace period. And then, so we're in 2025 now. And so definitely, I can now order this and it will update it. So it's very, very good with the logic, with the, as you order and enter data, updating the logic to these care gaps. All right, so the other part is if you want to just take a look at all of the care gaps at once and want in a little more space, you can click on the care gaps link here in the storyboard, and then you basically takes you where I am, right? So if let me close that health maintenance activity and instead click the full care gaps, it takes me to this activity, the health maintenance activity, and then I have all the care gaps, some awaiting completion because I ordered it, upcoming, and then items that are no longer recommended. Once I'm in the health maintenance activity, I can also access that group care gap smart set that would order all of the non-vaccine care gaps. I can also access the individual smart groups to meet the care gaps. What I can't find to do here is the thing to be able to postpone or add something manual. I can't find an option there. So I would have to kind of come back to the storyboard and use that address topic until I figure out how do I address the topic from here. All right, let's see if doesn't help if to close that. You can also, such as one of these completed or no longer recommended, maybe there's someone that they completed a pneumovax series, but you decided their risk was high enough that you were going to repeat that pneumovax in 5 or 10 years, right? Well, then you can manually add topics. So this could be manually add a pap smear, manually add a certain type of a colon cancer screening, right? You can add those items on your own if for some reason they are excluded based off of the logic of the base system. All right, so that's a nice touch to be able to also add topics on your own. All right, so let's go to a different patient and take a look at the care gap list. Oh boy. All right, so this patient has a much longer care gap list, and there's a lot more non-vaccine items. So, all right, so if I get it, I notice I'm not yet in an encounter. I just came to the chart. I looked up the patient, came to the chart, and so I'm not yet in any kind of an encounter. So it won't let me do anything as far as orders yet. In order to even start to put in any kind of orders when I've gone to a chart, I'm going to have to create an encounter, finding your create encounter activity, or in this case, I'm going to just edit one that's already there. But yeah, so that's open up this previous documentation encounter. Now my care gaps have the smart set button as well as that button, that one right there to do all the care gaps. All right, so let's click that one. Let's see what kind of a smart set we get here. All right, so our health maintenance dynamic smart set, it's going to give us saying, they need a foot exam. So we're going to kind of put in that order for the foot exam. And it even auto associates a diagnosis that's there on the patient's chart. Retinopathy screening, it's going to put in an ophthalmology referral. If I need to switch that to optometry, I can come in here, or if I'm going to do some kind of other, right? These newer in-office retinal exams. I don't know if we have an order created for that, but this could be used in a pinch probably to get that going. There's the hepatitis C screening again. And that's kind of the typical one that should be used nowadays, but there's a couple of others to choose from for orders, or you have a LabCorp, a Quest. So yeah, definitely some default lab issues will continue in Epic. Some logic will help with that, but others you're going to have to just be mindful of what lab is this going to. And in my typical fashion, I will try to label things wherever possible as far as what lab they will go to, if it's not synchronized between the labs. All right, we got the nephropathy screening with all right, there's the one microalbumin with the ratio. That's the one that the HMOs want. If for some reason you really had a compelling need for one of the other ones, they're there. And then we have the mammogram with other options as well. All right, so this is totally configurable. If you decide I don't want to order these things, you can uncheck it at this time. But no vaccines in this particular order set for that reason. I think that it'll be much more actively used and with a lot less unclicking, cleaning this up for that purpose. I'd like to finish up on one other little nugget. This would be still with our care gaps, health maintenance within Epic, and this is the pediatrics. So we mentioned that the dynamic smart set will not pull in vaccines, but maybe you do have a kid that is behind on vaccines, had a lot of no-shows, you got some data, but you just don't know where you stand. Obviously, using Florida shots is going to be important, but let's say they need a lot of shots and you want to get those orders in quickly. Well, yes, you could go through these one by one, or you could go to the health maintenance activity and order them one by one, or I have created kind of a standalone vaccine care gaps. Right, so if I were to just search Q vaccine, you may need to broaden your search if it's not initially in the facility list, but you'll see this here called PEDS vaccine care gaps. All right, that set of orders now does take all of the vaccine related care gaps in the storyboard and presents you with the order set. Now remember, because each practice does use different versions of different vaccines, there's going to be a need to really look through this and pick. So in some cases, you will need to choose a vaccine. Other cases, it will be pre-checked for you. Okay, but it at least presents all that information for you. This is, helpful outside of a well-child check, because yes, the well-child check express lanes will eventually have some really good vaccine pre-checked options there, but this one works even outside the setting of a well-child check and gives you the flexibility to choose what vaccine your practice is using. I believe that you can even have a nurse use this, and if you want to review it before anything gets done, they can pen the orders, pen them. Right? I just think that this is any kind of smart set that I'll be showing you from here on out. This one, the health maintenance, active dynamic smart set from here, as well as then the other three tools where you can get nursing involved with getting those started and penned items for you to just review, or you can be it's so easy to activate these and review them, you can do it yourself. All right, so the key thing though with the vaccines is, while I do have diagnoses in here to link to the immunization, you do still have to choose a vaccine. Some of them will have already say a reminder, choose one. Others don't yet have that reminder to choose one. So you do have to, because it doesn't give you kind of a red stop on choosing an item from that. And then the other one unusual thing about Epic here is when you do order things and link diagnoses such as vaccine diagnoses, right? In Allscripts, it would not make those diagnoses an assessment in your note. Well, Epic doesn't work that way. It will kind of make those an assessment in your note. All right, Allscripts would still put it in the plan because it would show that you ordered a vaccine and show what diagnosis it was linked to. But Epic will create a separate assessment in your note with those diagnoses and what the orders were. So just be mindful of that. You might have some abilities to hide that in the notes, right? There's an ability to hide areas in the notes, and so you, either in the right-click functionality in the assessment, and more so in the what's called the DAN notes, the diagnosis-aware notes. If you haven't gone through the note videos, then I highly recommend walking through those to get some of these other tips. All right, so that is the Q Vaccine Smart Set. Once you've ordered it, it will remember easily, or you can add it to your favorites. So add it to your favorites, the PEDS Vaccine Care Gaps. This is a dynamic set, it changes based off of rules with each patient, so you can't really do your own configuration of it as you can with some of these others where you can save your own version. So that one, you're kind of relying on the logic of the care gaps area, and then the smart set that was built to really just focus on vaccines for pediatrics. I hope you have found this helpful. Stay tuned as we dive into the smart sets in the next set of videos.